My name is Dr. Robert Remien. I'm a clinical psychologist and a professor of clinical psychology in the Psychiatry Department at Columbia University. I'm also a research scientist in the HIV Center for Clinical and Behavioral Studies, which is also part of the New York State Psychiatric Institute. Smart Couples Project was a study that was funded by the National Institute of Mental Health. We developed a new adherence intervention at the time, HIV adherence intervention, which focused on HIV serodiscordant couples. All adherence interventions at that time, and still most of them to today, focus on the patient as the individual. What we chose to do was to identify and work with serodiscordant couples in which the HIV positive person was having trouble with adherence to their HIV treatment. Serodiscordant couple is fundamentally a couple where one person is HIV positive and the other person is uninfected, HIV negative. And in our study, we worked with couples that were heterosexual, and half of those, the man was positive, and the other half, the woman was positive. We also had gay couples, gay male couples, and we had lesbian couples. Again, in all cases, one member of the couple was infected, the other was uninfected. Smart Couples is unique from other adherence interventions because we do target the couple as the unit of intervention, and in the case of the study, the unit of analysis. Most adherence interventions typically target the patient as the individual and trying to get the patient to improve their adherence to care and treatment. We wanted to work with couples because we know that it's important. Social support is an important element. Social support is an important element in terms of people doing well and adhering to their care and staying healthy. And in the context of serodiscordant couples, you have both concerns about the health of the infected individual, while also there are concerns about the health of the negative individual and specifically keeping them uninfected. So working with the couple as a unit, you can increase things like motivation and skills around adherence for both of them, but you can also address issues around sexual transmission risk behaviors for the couple. Smart Couples is similar to other adherence interventions in that it has a lot of common elements that have been shown to be effective in research for improving adherence or establishing good adherence for people living with and coping with HIV. Those elements include things like knowledge and understanding of the virus and how it works, how it replicates and is replicating even when one can get a test result that says their viral load is undetectable. The patient needs to understand that the virus is always replicating, and that's important to adhere very strictly and very closely to their HIV treatment. HIV treatment is a little bit unique compared to other chronic conditions where it requires much higher levels of adherence, such as 90 or 95% adherence, to take your treatment regularly and consistently and on time. So knowledge and understanding of those facts, of that reality. There's also a concept known as risk perception. People generally, research has shown, people need to understand that there is a level of risk if they don't engage in a certain behavior or engage in a certain kind of behavior that brings risk. In the context of HIV treatment, the risk is if I don't take my medication regularly, that my immune system can start to decline. And that could be independent of whether I'm feeling healthy or not feeling healthy. So people need to understand that and how the immune system works, how the medication works. Then there are things like motivation. That's common to most adherence interventions, is trying to increase someone's motivation to stay healthy, to take their medication. And in the context of Smart Couples, we're addressing all of these things for both members of the couple, that both members of the couple are motivated to keep the infected person as healthy as possible. And then the final, I think, big element that is common to most adherence interventions and included in Smart Couples is skills. And just being able to maintain high levels of adherence, be able to continue to take your medication even when your lifestyle is very busy or there's disruption in your routine or you're traveling, you're away from home. People need to sort of just think about the skills of always having their medication on hand. And in our case, you've got two people addressing all of these things instead of just the patient by his or herself. Involving the partner, be they a romantic partner, a primary partner in this kind of intervention, this kind of program, is important because social support is important for people taking care of themselves and adhering to treatment and care. So here you're bringing in and you're adding to the social support that the person has in their life, specifically with this primary partner, to be a support person for their treatment. So that's why it's important that the support partner understands the reason for high adherence and can join in being motivated in taking care of the person living with HIV, taking medication regularly, whether it's once a day, twice a day, or 3 times a day, but being very consistent in that. There's also, we framed this intervention as being about mutual caretaking. So it's really about the couple taking care of themselves and the health of both of them and the health of the couple. So in the context of an HIV serodiscordant couple, you're dealing with keeping the positive person as healthy as possible. You're also working to keep the negative person uninfected and having them support each other in these mutual goals.